Healthcare in many parts of Africa is still paper-based. Patients' history is written on books, and we have long lines waiting for diagnoses and everything. And now we are hearing that AI is coming to save the future. But can it really? Especially when Africa doesn't have its data used to train AI. Hello everybody and welcome back to Secure Africa. I am your host, Darren. If you have ever waited hours at a hospital line, been given the wrong medication, or struggled to get proper care, then this episode is for you. Because today, healthcare isn't just about doctors anymore, it's also about technology, and the right one for that matter. And right now, AI is driving the transformation from faster and more accurate diagnosis to improving drug safety and to helping healthcare workers be able to document and perform their tasks in a timely manner. It also helps pharmacists make better decisions on your prescriptions. So as you can see, AI is already changing a lot in the healthcare sector. But here's the real question. Can it truly work for Africa? And joining us today is Dr. Oke, a pharmaceutical doctor and a tech expert working across the globe, including in the United States and in Africa, at the forefront of AI in healthcare. We're going to be talking to her today, and you're going to learn a lot. So please stay with us, and when we're back, you're going to hear how AI is going to help transform your healthcare.
Africa, hey, 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 Africa, hey.
All right, Dr. Oke, thank you very much for joining us today. We really appreciate you coming to share your knowledge about AI and healthcare with us today.
Oh, thank you for having me. It's an honor to be here today.
Thank you. And you have worked across from healthcare to technology, and now you are championing some very good work in AI, right? How did you end up in this cross-section between technology and healthcare?
So I'm a clinical pharmacist and an entrepreneur. I'm a speaker and a coach. So I'm a clinical pharmacist by training. I've been working for almost 20 years here in Washington, D.C. and Maryland and Virginia. So I work in so many different hospitals here in Maryland. So I'm currently part-time for the VA Veterans Affairs Medical Center in D.C. and I'm PRN for Mesta. I have an AI consultant company here, registered here in Maryland, but it's more specifically aimed to Africa.
Okay.
So over time, so I realized that healthcare is very reactive. We treat problem after they happen. So I decided to open a health and wellness center where I sell vitamins and I give consultation in Gabon and Côte d'Ivoire. So because I'm from Gabon and my husband is from Côte d'Ivoire.
Oh, okay, that's nice.
Yes.
So you're saving both countries at this point.
Yes. So and 3 years ago I decided to go back to school to do health informatics. So I have my master. In health informatics.
So what made you to go back to school to study health informatics? So because you are a pharmaceutical doctor.
I'm a pharmacist.
And
yeah.
So why did you decide to go and do technology to add it
Because
to?
I
Because
wanted
it's
to learn.
rare.
Yeah, because I don't like to be comfortable in some places. Because I've been working since it's almost 20 years. I've been a pharmacist, so I wanted to make a change. I wanted to learn about technology. I wanted to learn about informatics, pharmacy informatics, health informatics.
Oh, okay. Mm-hmm.
Because I wanted to work from home too. After COVID, during COVID, a lot of people were working from home. I wanted to try that. I wanted to have the capability also to be able to work from home. So I was
But
like, okay,
as a pharmacist, you cannot really work from home. You need to be at the pharmacy distributing
Yes.
and giving patients advice on how to take medication and all that.
Yes.
But you wanted to
Especially,
be close to family.
yeah, especially when you work in a hospital, it's hard to work from home unless you have a job in a like insurance company or like the FDA, like federal job. You can work from home, but in order for you, when you're a clinical pharmacist in a hospital, it's very hard. So I wanted to, work from home. So I said, okay, let me try to go back to school and do health informatic. So I
Oh,
was
that's good.
between artificial intelligence and health informatic.
This episode today is sponsored by Zoo Cybersecurity Academy. If you want to get hands-on experience, if you want to get big started with cybersecurity, Zoo Cyber Academy is the place to go. And today, I'm giving you something special. They have accepted to train African students and all African professionals who want to switch to cybersecurity with a 50% discount. What you need to do is just to use the code SecureAfrique at your checkout, and you are going to have 50% off from this training. So go and enjoy your training and join the world of cybersecurity. That's good. That's nice. That's good to hear why you have this degree, because, like I said, it's rare to see people with this combination. So
Yes, yes.
now you have been practicing healthcare, or you have been a practicing pharmacist for some time now, right?
Yes,
And
yeah.
when you look at the field of healthcare 10 years ago, and looking at it when it comes to diagnostic, when it comes to drug safety, when it comes to automation, and when it comes to helping make decisions or life-saving decisions for patients. And now in the present, 10 years and now, like what has changed with the coming of AI?
Today, I work at the intersection of AI, medication safety, and wellness through my companies. A lot of hospitals now are implementing AI. So there's a lot of things that have changed. There's a lot of things that has changed in the pharmacy field. So pharmacy 10 years ago, now everything is electronic health record, everything is recorded, everything is automated, everything is electronic. Like 10 years ago, we don't have paperwork anymore, everything is electronized, right? AI in healthcare simply means using technology, right, to analyze data faster and support better decisions.
So that's helping. When you say analyze data, that's analyzing the the samples that we collect from, or the patient information that we collect in order to help diagnose
Diagnose.
their medical
Yeah.
condition and all that. So it's
Yes.
helping
Yes.
that to be faster.
It's going to help to be faster. It's going to detect disease earlier, like cancer or diabetes, right? It's going to improve drug safety. Especially in Africa, we have a lot of issue on drug safety, pharmacovigilance, because we don't have systems. Everything is paperwork, especially
So how,
in my
how, how
country.
is it going to help this in terms of when you talk about drug safety in Africa? Someone in the street that is going and buying drugs from, how these small pop pharmaceutical boxes are everywhere beside the road. I mean, everyone is like a pharmaceutical doctor. They just need to go and buy and start selling. How does this help people who are buying drugs at the street side or corner of the streets to be able to know which one is safe, which one is not safe, and all this?
It's all about education. We have to train people. We have to educate our population, right? And the government they have to invest in healthcare. They have to build data center.
Okay.
So how do we do here in America? We don't buy drug on the street. So we have to do campaign about it, right? So it has to start from somewhere. We have to educate our people. We have to do campaign that buying drug on the street is not good.
So how do AI come in terms of doing campaigns and or teaching people about drug safety? Where does AI come in that case?
AI is going to help us do our work faster. It's going to help us like make a like how can I say that? Make like model, like statistic. Where can we go? Which places? So how many population is in this capital? Is in this village? Where can we go and educate people about drug safety, about the drug on the street is no good.
Okay. So education. So you're talking about go to this village or go to this street and teach people. So would AI be able to, like, when you collect this data about the population of the country and probably of different cities and towns and villages, would it be able to and also identify where people are more prone to less drug safety? Will it be able
Yeah,
then to help you target those people and the type of training that you will need for those people and how you can train those people? Is that
yeah,
what I'm
because we're
hearing?
going to collect data. We need data first because AI is working with data.
Okay.
We need to collect data. We need to do survey. We uh, we're going to gather the data and put it in the system, in the AI system, and AI is going to help us.
Yeah.
Yeah. So
So
right.
yeah, go ahead.
Go ahead. Go ahead. Go
Yeah.
ahead.
So no, I was gonna talk about when we say we're going to build system, right? You already started talking about, for example, pharmaceutical systems, and you were saying like there's not that many of hospitals or facilities in Africa that have a good pharmaceutical systems like that could help these drug dispenses and could help also disposition of drugs to patients and all that, right? Now we're talking about AI, and you are rightfully talking about data, but we're talking about African country of African hospitals or health clinics that more write a lot of their things. Majority of them, if not 80%, I will be sure, are still writing these things, patients' data in books, right? And they are still in paper. They are not in any database anyway. Where is this data going to come from to be able to help AI to make this determination, to be able to help AI to analyze, to be able to train the AI
That's why.
systems, to be able to
That's
help
why
us?
a lot of country in Africa and right now they are building data center. They are building data center. I don't know about Cameroon, but in Gabon they are starting to build data center. In Ivory Coast they are starting to build data center because it's the era, it's the AI era, and governments are putting money in AI right now in Africa. If you look at Rwanda is advancing in AI. If you look at Kenya and South Africa, they are advancing in AI. They are building data center. So AI automation and the patient experience. So AI can improve patient access to care. AI is going to have faster triage. Who need urgent care? The communication will be faster. It will be easier. So so AI is going to improve by understanding the patient need. So that's why we need to go to different places like villages, like different places in the capital to do survey. We need to collect the data.
Yeah, but okay, that's true. Going to villages and also giving accessibility to healthcare, right? But when you go to these villages, let's even say not only villages, but when you go to these health facilities, right? The technological infrastructure, right? We're talking about data centers, and we're saying that some countries are building. I think not all yet, but some countries have started trying to build the data centers. But when you go to hospitals in rural areas, not even only in rural areas, like I said, even in cities, you're going to see healthcare workers that do not even have a laptop, healthcare workers that do not even have a phone that can even input any information, right? They have only these flash phones and no phone, no sophisticated phone, no Android, no iOS device. So uh, they are not even trained. Majority of them, or a lot of them, have never seen a computer. They have never typed. How are they going to use these sophisticated systems that are being built?
That's We have to start small. We cannot just. It's not going to. It's not going to be 100%. We're going to start with the capital first, right? We're going to start with small, 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 and we go to the rural places, right? So, can AI work effectively in Africa? Yes, but it requires different approach. requires different approach. So we cannot simply import solution built in the US, the Europe. It's different, right? So what we need, it's a context specific to AI, you know, tool design to low design to low resources setting, optimizing for intermittent connectivity. So no, we need to build to work with community health worker. So I said it's going to start small, and train the African patient data. We have to train the African patient data. It's going to be hard, but it's possible.
So when we have we do have the, let me say, the talent.
A lot of people have smartphone though. You'll be surprised. A lot of people have
Yeah, a
smartphone.
lot of people have smartphones.
They
Yeah,
have
a lot of people
smartphone.
have smartphones, right? But
You
the
know,
thing is how to use those smartphones. So it's not
we're
okay.
going to teach them.
All
We're
right.
going to teach them,
How
right? We're going to
how
teach them.
have you spoken to some government entities in Africa about this initiative?
I spoke to one person. In Africa,
Yeah.
it takes time. It takes time. It
And are
takes
they
time. Yeah.
receptive to this idea? And how are they planning on how they can train people?
People are interesting. Yeah, people are reaching out to me. They want to know more. So that's why I'm going now to
Okay.
Gabon.
So
It's in life, if you don't try something, you will never know, right? So I'm here in America. I work for 20 years as a pharmacist. So I'm combining my clinical expertise and AI to to help build the AI in healthcare system in Africa. Because here in America, they already have everything. There's so many companies that are building software for drug safety, pharmacovigilance. It's already set up here. So Africa needs us. It's possible. It's possible. The government just need to invest in AI. They need to invest in healthcare. And it's starting now. If you see the South Africa, Rwanda, Kenya, all these Anglophone countries, they are investing in healthcare. The healthcare quality is better than us. So it's possible. So we need to change the mentality. We need to educate and train
yeah.
people and educate the people in the village.
Okay, that's good. As long as we would have a better way to train them and follow up on them and this thing can work, I think I believe that it could be something that bridges the gap between having good healthcare and probably not having zero
Yeah.
healthcare, probably especially in the rural areas, right? So I hear a lot about automation of and using AI to automate a lot of things in healthcare. What does this mean? What are some of the things in healthcare that we are looking at that AI would help automate?
Yeah, but the AI is going to be inside the system, but they're still going to talk to a doctor and a
Yeah, I
nurse.
mean this is now like a
It's not
backup in
AI.
case that they cannot
You
see
know what
the
I mean?
doctor in the evening. Yeah.
It's going to be a backup. It's just the AI is going to improve patient access to care. It's faster. There's going to be faster triage. Who need urgent care? The communication will be faster. You know, AI will improve by understanding the patient needs. Everything will be like automate, like it will be faster, and it will give instant response to the patient. It's going to guide the patient to the right care.
So how
So
would this look
AI,
like? Will it be a case of a patient having an app, an AI chatbot, or will it? How will this look like? Or will it be a phone call
no,
and then they will go to a
no, the
machine that is an
patient,
AI, or how will
no,
this look like?
no. It's not the AI that the patient is going to talk to. The patient is still going to go to the
Okay.
hospital. The patient is still going to
Okay.
go to the hospital. Yeah, it's going to be easier for the hospital. A lot of hospitals here are implementing AI to make everything faster and efficiency, to detect like disease earlier,
Yeah.
right? Um, to improve. the drug safety system. Like me, I'm talking more about drug safety pharmacovigilance because
Yeah, yeah,
I'm the
yeah, yeah. I get
pharmacist,
it.
right? So so like example, if a patient is going to the pharmacy right now in Africa and we have a system, an AI system in place, and the patient is telling you that he's taking this drug and this drug, the AI will notify you if there's some interaction or not.
Okay. So the AI notifies the it will notify like the pharmacist.
Will- it will,
And
yeah, it will notify the pharmacist that, oh, these two drug, these three drug, can the patient cannot take it because maybe of the patient age, of the patient age, creatinine clearance, the patient what type of diagnosis he has. Some medication can affect liver, some medication can affect
yeah.
the kidneys, right? And there's some medication, if you take, it will mess up your kidney, it will mess up your liver. So AI will help the it will help the doctor, the pharmacist, to know this
So
interaction.
so AI would do that now. So in the past, how did they used to look like? How long would an analysis like that take for a pharmacist to do, and what would be the struggles that they will have to go through, and how has AI like really? I'm just trying to see how AI has really will really change this for them.
So the thing is, I never work in Gabon, but I have friends who are pharmacists there. They don't have system that alert them of
So
drug
there's
interaction.
completely no system right now. Like what about your
There's no
experience in the
there's
United
no
States?
there's no there's
Yeah.
no system. Oh, but here you can, here we have system. Like I will tell you, 15
Yeah.
years ago, everything was on
Yeah.
paper, right? Everything was on paper. So they built
Mhm.
a system. So now in pharmacy, you have software that you call Epic. You have Cerner. You have so
I
many
know about Epic.
software
Yeah.
that Epic. That will make the pharmacy job
Mhm.
easier, right? It helps us, right? We have a patient profile. We have all the information of the patient. We know everything
Mhm.
about the patient, from the outpatient, from home medication to the outpatient medication to the inpatient
Mhm.
medication. We have everything. So when the doctor order a medication, if there's an issue, if there's a drug interaction, it will flag. The system will flag. The system will say interaction, high risk or
Yeah.
low risk, right? So we have to use a clinical judgment, or we have to call the doctor to say, look, this drug is not good for this patient. Change it to
So
this drug.
is
It
that
will be
clinical
safer.
judgment now where AI is coming to facilitate and help you make a better decision, or how is it?
No, AI. I'm the one with the
Mhm.
clinical judgment. AI is just going to help me do
Mhm.
my job faster. It's not going to do the clinical judgment for me. I'm the pharmacist. AI is not the pharmacist. AI is AI is going to help me, but the clinical judgment is still the pharmacist and is still the doctor.
Okay. So okay, but now we're talking about places in Africa, and you're talking about Gabon, and you're saying that there's not even systems like this. Like there's not even software applications like this. They don't even have a patient's history of their drugs that they have taken in the past and all that. I remember when we used to go to the hospital back in the days, we have books. When you go, they will take this small book and they'll give it to you, and that's the book that they write your medical history. And each time you come to the hospital, you bring it along. Sometimes it get missing, and if it's missing, then your medical history is gone. Right? No one would be able to know what has been happening for the years if the hospital did not record it. Because the hospital, to keep the record of a whole city for everyone in books is hard. And I understand that. Now, and we're being and you are very optimistic about AI being able to be implemented in Africa and being able to, and yeah, and that
You
it will
have
work.
to. You have to be
But it
optimistic.
looks like we have to start from a very far place, you know?
No, the thing is, things are
Yeah.
changing. we are in a new era. I don't know. I'm going to talk about countries like Gabon, Ivory Coast, and a lot of countries who are implementing AI. Because I read a lot. So governments has to invest in healthcare, and they are starting to invest in healthcare. AI is already here. So they want to bring AI to Africa. So they are investing in technology. It's coming, but they need people like me to help them implement AI. Right? So how can AI improve patient interaction, triage, access to care? So like you were talking about chatbot, right? So AI powered chatbot and voice assistant, like you say, can serve as the first point of contact, 24 hours a day, 7 days a week. So they can assess symptom, provide basic health education. They can recommend when to seek urgent care by just talking to the chatbot, right? And they even can contact the patient directly to the pharmacist or the physician through telemedicine. Like you say, a lot of people in the village don't have phone, but you'll be surprised. People in the village, they have smartphone now. My grandma used to have a smartphone. People talk on WhatsApp.
Yeah, I mean, WhatsApp
You'll
WhatsApp
be
is a big
surprised.
thing. I mean, a lot of people have WhatsApp. Yeah.
Yeah, once people talk on WhatsApp in a village, right? So we are evolving in Africa. Africa is changing now. Africa is changing now. It's not the Africa 10 years ago, 20 years ago. It's changing. So that's why I want to, my business, it's specifically for Africa. So that's why you see me do a lot of post it, because it's possible. And they need me, they need you, they need the Cameroonian doctors, pharmacists here to go help them to implement AI.
These doctors, like you guys that are expert in this field, right, that have the knowledge, that have worked in the Western world, and you have been blessed to work in good healthcare facilities, I mean exceptional healthcare facilities, and you have this experience to take back and help grow, right? Now when you go back, let's say you guys go back, they come pick you guys here and say, okay, come and help us grow, help and improve the healthcare system, right? As a pharmacist, and also others that will go as doctors, everyone responds, when you're looking at treatment, everyone responds to drugs in different ways, right? And genetics play a huge part in how people respond to drugs, right, based on what you give them. Africa has one of the most genetically diverse population in the world, but like less than, I think, what is it, less than 5% of the pharmacogenomics, or whatever they call it, pharmacogenomics data or something like that, comes from Africa, which means less than the systems, what the systems have been trained on. Very low data from what the AI systems have been trained on, comes from Africa, if at all anything. So how is this going to help make accurate decisions? So how can AI then make accurate decisions based on the fact that we don't have this data used to train the AI systems?
So this is what we call precision medicine. This is precision medicine. So we know, we now know that genetics variation determine how patient metabolize the drug. What works for one person can be toxic for the other, right? That's what we call pharmacogenomics. So that's why we need people who are specialized in pharmacogenomics. So we need to train people for pharmacogenomics. So, this is the study of how the gene how the gene affect the drug
Yeah.
response,
But doc, no
right?
matter how we
So
train these people, doc, is this going to help them? Is AI going to be able to help them if we, no matter how we train them?
yeah, AI is because AI is going to allow us to integrate genetic data, clinical data, and the lifestyle data to personalize to personalize treatment in a way we never could
So
before.
it's so they are going to still collect that data and input into AI in order to train the
Yeah.
system before they can be able to use it. Is that what? So there's
Yes.
still a
Yes.
long way to go. So we are
Yeah.
still in a very infant stage where we even still need to collect the data and transform it to a digital
Yeah.
form and
Yeah.
put it in this system before train the AI before we can even see how these pharmacists can even use this to help them.
But you have to understand that we have to start
Yeah, yeah,
from
yeah,
somewhere. We have to start. There's a lot of questions that you're going to
yeah.
ask me. I'm going to try
You
to
are very
answer,
optimistic, I must
but
tell
we
you. You
have
are
to
very
start.
optimistic about.
But but we have
Yeah.
to start from somewhere. America, they start from
Yeah, yeah.
somewhere,
How,
right?
how long is this going to take us, though? Based on the fact that we know how slow, and especially when it comes to healthcare, we're going to need our governments. We know sometimes how it's slow for our governments to work in things like this, in most cases.
And that's not a minor and that's not a minor inconvenience. That is a patient safety crisis waiting to happen. So if you see on my LinkedIn page, I have a newsletter saying under the cloud. All right, saying under the cloud. There's going to be a lot of issue with AI implementation in
And that's
Africa.
why I've been trying to get how easy or hard will this be for us,
So,
right?
but yeah, that's why we need to work. That's why we need to work together. You know, we have to be optimistic, right? It's possible. America come from somewhere. How did they do that? African government, they need to invest money in technology, AI, in healthcare, in education. Is very important because all uneducated African, we are all here in America and Europe, right? So this is the one of the core problem my company exists to address. That's why I create my company for this type of issue. And I'm doing a lot of work behind the scene to resolve that because it's
Yeah, and
possible.
and it's possible. No, there's absolutely no doubt that it is possible.
It's possible.
And yeah,
It's
but when
possible.
when we talk about talent or African skilled in European countries, in America, and maybe in some of the developed Asian countries, we when we're looking at this, Africa has talent, and that's something I've been talking about a lot. Right, there is huge talent in the continent that can do things that you would probably never believe that they could do. But the problem is, how do we develop the skills of this talent? Because talent alone,
We,
without the infrastructure
we have
to
to train
train
them.
them and train their
We have to
skills,
train. We have to train them. We do have to train them. Like now today, how AI is already being used. AI is being used in diagnostic. AI is helping detect some diseases like diabetic, tuberculosis, certain cancer with remarkable accuracy. Like in drug safety, which is my specialty, AI is revolutionizing pharmacovigilance by automating the detection of adverse drug reaction from big data sets, right? So we have to train people there. We have to train people in Gabon. We have to train people in Cameroon. We have to train people in Congo. But the government has to put some money. They have to invest, right? You see today, right? You see right now in America, everything is AI. There's money in
oh
AI
yeah,
right now.
a lot of things are running. Everyone is rushing to
Some
implement
put like
AI. I mean, in all kinds of
yeah,
sectors.
because because there's money. There's money in AI right now. The government are putting money in AI, right?
Yeah,
So
and
that's
two, there
why,
are also governments in Africa, like you already started talking about, right? There are also countries in Africa like
yeah,
Kenya,
they're all
like Ethiopia, right, that are already
Kenya,
working on this, right,
Ethiopia, right?
and working.
They are
Yeah,
already working
yeah.
on it, right? So, so why me as a pharmacist? I cannot do it. Let me just implement something that I know, drug safety, my pharmacy skill, and combine AI with it, right? And work on it, work hard with the AI tools. The AI tool will help me do my job, how I can help Gabon, how I can help Cameroon. And I go there and present it. They like it. That's how I solve their
Apart
problem.
from training, how would your drug safety AI powered platform look like? What is included in that?
So my drug is going to be patient history, outpatient medication, inpatient, what the patient is taking outside. If it's like an outpatient, what the patient is taking, the disease state. We need to know also the disease because there's some disease also that interact. We have to be careful because there's some drug. If you give it to some patient with maybe hypertension, they might get clot. So in my AI software, there's going to be patient history, there's going to be interaction, there's going to be category of the drug, there's going to be food and drug interaction, patient history, um, patient history, the data, data, the data set. There's going to be like basically interaction because it's drugs, it's drug safety, and there's going to be surveillance, like monitoring too.
How do you plan to collect this data? What are the means that you're going to use to collect this data before you train this AI platform and be able to use to help the country? Is it going to be you going to hospitals, clinics, or how is this?
I mean, right now, my country, they are building a data center. So we have issue from getting data.
That
That's
but would anybody just go into that to that? I would assume that Gabon do have a lot of patient data or privacy laws and all that, right? Like the HIPAA that we have in the United States, right? Is that not going to be a hindering issue? How are you going to navigate privacy of patients' data and all that? What if, because normally before they share that data to you and they're supposed to get patients' consent.
when a company here in America is putting a new system, you have to go through
Yeah.
compliance. So I'm sure I have to go through the company, the hospital compliance department, and sign some paper work,
Yeah. Yes.
right? Because I'm going to implement a system, so I need to get access to patient record.
Of course.
So I have
Of
to go
course.
through the compliance. So I have to go through the compliance department and know their policy.
Okay. Okay. And then once you get that, before you can, and then you sign the necessary agreements
The sign
and
agreement,
get the
yeah.
non-disclosure agreements and all that before you can get that into your
Disclosure, yeah.
system.
Yes, yes.
Okay. What is safety for this data look like? Because we like, right, we are technology, we are talking technology here, and the good part is that this data is going to help us help the patients, right, and help the population and even generations to come. How are we going to protect that data, right? We are seeing that a lot of, in Africa now, there is a rise in attacks on healthcare data or healthcare systems. Are you also planning a way to protect this data in your plan? Is that something you're looking at as well?
Of course, you have to protect. That's how we call AI governance. You have to AI ethic. We have to protect everything. You have to protect everything is very important. So when you are building the software, when they are building the software, they are helping you also protect the data, because safety means protecting the patient, their data, and ensuring that AI makes the right decision. So how am I going to protect it in Africa? So the patient data must be confidential, it must be secure first, and not share anything without
Yeah.
consent. So because the patient health is very important. It's like an
No, it's
identity.
very important. That's why Kenya has built this system that is helping them to detect pneumonia in children faster, right? And Ethiopia has this one that helps frontline healthcare workers to be able to answer questions in real time and all that. I know we spoke about this briefly, but what does this example tell Africa about the path forward for AI?
What they can
Yeah, how does
what they
this
can learn.
benefit other African countries that haven't done anything yet, right? If for example, let's say that a country like Somalia or a country like the Gambia looks at what Kenya is doing. Kenya already has a system that they have built that is using AI and is able to detect pneumonia in children faster. And Ethiopia already has another system that is helping healthcare workers that are in the front line to able to answer questions quickly or to be able to triage things quickly. What can other countries that haven't even done anything or even thought about AI in healthcare, what would they be learning from this? What should they be learning?
They should be learning that if Kenya, Rwanda can do that, they can do it too, right? So it tells us that Africa doesn't need to copy America. It doesn't need to copy Silicon Valley playbook. We can create our own playbook in Africa. Africa can leapfrog. It can leapfrog, just as it did with mobile banking before physical banking infrastructure was complete. So the continent can build AI solutions that are designed for its realities. We can do that.
So, Doc, when you say Africa can leapfrog the Silicon Valley and we can do that on our own, right? I don't doubt I
Yeah, we can
don't
do that on our
doubt
own.
you that we can do it on our own, right? But we are talking about Africa. We're not talking about Gabon. We're not talking about Cameroon. We're not talking about Nigeria or Kenya or Gambia, right? But the reality that I wanted to ask you is this, Doc. When you look at Africa now, there's a lot of barriers when it comes to collaboration in security, collaboration in healthcare, collaboration in education, collaboration in business, traveling, and all that. For somebody to leave, I was talking to Mr. Aja in my last episode, in the last episode, and we were talking about the barriers that they have to go through, or business people have to go through. Not only business people, but Africans have to go through to travel from one African country to the next. Go from Kenya to South Africa, from Kenya to Cameroon, and all that, needing a visa and all that. All these barriers and all these regional blocks. Cameroon has different laws when it concerns healthcare to Rwanda, to Gabon, to Ivory Coast, right? Different structures. And then when they come together to do something like this, to work, to form let's say they come to build a system that will work for all Africans. How difficult do you think this is going to be when we don't have this type of collaboration? America is an example of what we can learn from, of course, like you're saying. America has how many states we have in this country, right? And these states are huge. They are like countries, but they work together in order to accomplish things for the common goods of the citizen. But Africa is like we cannot work together. It's like we are cursed in trying to work together, right? It's like
Oh yeah, it's true. It's true. There's a lot of, this is a real and honest topic, a powerful topic. You know what I mean? So um it's a powerful topic. There's a lot of barriers, like you say, it's very challenging for me to do business in Africa. But I believe in what I'm doing. I believe in my vision. You know, I My business back home right now is working pretty well. People love it because it's like innovation for them.
So, question for you, right? Your business is working very well in Gabon right now. How easy would it be for you to establish that business in your husband's country in Cote d'Ivoire?
I have it in Cote d'Ivoire too.
You have it in Cote d'Ivoire too. Okay,
Yeah,
good.
yeah. People are asking me how I do it.
Okay,
You just
that's
have,
good.
you just have to believe in what you are doing, because if you're thinking about the lack of trust, barriers, blockage in Africa, you're never going to do anything. You're going to
Okay,
stay here in America
okay.
and retire here.
Yeah, yeah. No, no, that's good. My
Yeah,
concern
but
was only
then
about
the
the
thing is,
collaboration that we were talking about,
no,
and like you're
no.
saying,
The thing is, without collaboration, we need data. Data stuff. We need data. Solution. The solution don't scale. So Africa has to collaborate. It's changing now. It's changing now. So they need me. I know Africa need me. I'm going to go there. I know I'm taking big risk, but I believe in my vision. I believe in Farmer Eli. I believe that with the new era of AI, Africa is going to change. It's going to change. My role is to connect the ecosystem, not just build a tools. Is to connect the ecosystem. So
so,
I have to
so,
do a lot of education, a lot of visibility. That's why you see me a lot on LinkedIn, so people can see me.
so talking about education, doc. Talking about education, what do you think has to change? Because we are still building these systems now, especially in Africa, like you're talking about, right? What has to change on how to train healthcare workers for the future AI driven healthcare system that we are trying to build right now? Is it a case where doctors now need to understand technology? And nurses need to understand technology now to prepare for that AI driven
Of course,
healthcare
yeah,
future that we're
definitely,
building?
definitely. Everybody in healthcare need to understand technology. Otherwise, you
Yeah.
stay behind. This
Do
is
you?
a new. This is a new era. It's the era before COVID is finished. It's over.
Yeah, no, no, that's right. The era before
It's
COVID is.
it's no, seriously. Do you know how many? Do you know how many people here in America, especially elderly, who's taking AI classes? Some classes are There's 5,000 connected, 10,000 people connected, and most of them they are Caucasian, white people. Why?
Yeah. No, no, no. A lot of people, because
Because
AI is going to
African, they
change. AI
don't
is
believe in
changing.
AI. People, they still
Yeah.
don't know anything. Yesterday, I gave a class in AI for beginners. Do you believe that there's some people they don't even know what is Chat GPT?
I mean, there are a lot of people that do not. I mean,
Do you
that's
know
not
that a
surprising.
lot of Africans are making fun of me because I use AI pictures?
They are going to see that a lot.
It's an
Okay.
AI era. How you
Okay.
cannot go to Africa and teach? I
Okay.
live in America, so I have to use to use this opportunity that I have here in America. Use my skill, my experience as a pharmacist. Learn AI. What I learn in AI. Do training to teach people, educate people on AI. Right? That's how you make impact.
So let's talk. Let's talk
That's
beyond
that's how.
healthcare, right?
Okay.
Beyond
Yeah.
healthcare.
Yeah.
In terms of Africa, what do you think like a responsible AI innovation looks like for Africa beyond healthcare? Something that is ethical.
Something that
How?
is ethical.
Yeah, yeah. How do we make sure that the society actually benefits? The social have social benefits from AI, not just big companies, right? Because when we're talking about AI in healthcare, maybe it's going to be one big company in healthcare, one big a government organization, and all that. But what about the common man in the street? What can they realistically use AI to better their lives, not only in healthcare but social issues? I mean, just better themselves and their families and their family life. Yeah.
So with AI right now, there's so many things that you can do. You can have a business in AI. You can build digital products. AI should not just be built for Africa. It must be built with Africa by African and for African reality. So we need to right now in AI you can build a business. People can do content creation. They can even do songs through AI. They can write books. There's so many things you can I can right now with my AI experience right now. I can train healthcare professional, student, entrepreneur, because I make AI simple, accessible, and practical. So there's so much thing that you can do with AI. You have to use the right tool in AI, especially in entrepreneurship. Entrepreneurship, there's so much tool to write content, to write proposal, to do videos, to do picture. There's so much tool, but you have to know which AI tool to use, you know. And there's so much thing that you can do with AI. African people can use AI, but we have to educate them on how to use AI. And there's a lot of company right now. The company is putting in place company like people who have like a AI business to teach people about AI.
Yeah. So doc, in just for us to, we are about rounding up here, right? If Africa gets AI right in healthcare, let's say we get it right, right? And I wish we do. What would the future look for it what would 10 years look like from now?
In 10 years, Africa will get AI. In 10 years, Africa we're going to leapfrog. Healthcare will become preventive. We're going to be like America. We're going to improve. We're going to the healthcare will become preventive. We're going to have early disease detection. We're going to personalize treatment. Like here, there's going to be fewer medication error. We're going to move from treating illness to preventing it. There's going to be access to care for everyone, like AI power tool in rural areas, undeserved community, mobile first healthcare. There's going to be mobile healthcare. Where there's no doctor, there will be access to care through telemedicine. The system will be smarter. We're going to digitize patient record. There's going to be faster decision. Doctor will make faster decision. No more guessing. The data will be driven with care. We're going to have data center. It's going to
Well, nice.
evolution, innovation. Economic transformation, new job in AI, health technology, digital innovation. There's going to be growth in African startup. You know what I mean?
Yeah, that would be fantastic.
AI will become a driver of economic growth, not just technology.
Wow. That would be massive, right?
Yeah.
Two things for you before we end, right? What would be the advice that you would give any healthcare sector or hospital or facility, or even the governments or anyone listening to us today, when it comes to AI in healthcare?
So I believe, like I say, I'm keep going to say to everybody, we live in a new era, the AI era. We cannot be scared of AI. AI is already there. So don't be afraid of AI. We need to learn how to use AI. We don't need to be experts. We don't need to be a tech like in IT to know AI. We just need to learn the basic, how to use the AI tools in our life and a job, in a business, at work. So the biggest mistake for us African is like we like to think too much. we like to think about barriers, blockage. The government is good. The government is not good. No, we have to be optimists. So we cannot wait too long. We need to start now. We need to learn the basic of AI. What can AI do to Africa? What it cannot do. So we don't need to code. We don't need to know coding. We just need to understand AI. And there's so much classes, so much certification out there online that people can do for free, like Claude right now. Claude, they are giving free, they are teaching free certificates online. Coursera, even Harvard, they're giving free certificates online.
Okay, Doc, can you tell us about your nutrition business and how people can get to you in case they want to contact you for any help on that?
So my vitamin business, so the name of my business is Naturali. So I sell vitamins, so I always consult people about vitamins, taking the vitamins, especially vitamin C, vitamin D, vitamin B, to boost your immune system, to protect yourself from getting sick, from getting some diseases. So my holistic wellness brand focus on prevention, education, and I advise people, I encourage people to take control of their health through prevention, not just treatment. So my healthcare center is in Gabon and Ivory Coast. Yeah, or if they're interested, they can reach out to me. I'm on LinkedIn under Annouchka Ondias-Kouame. I'm also in Instagram under Dr. Kanouche, Dr. Kanouche, and also on Facebook under Annouchka Ondias-Kouame.
Okay, Doc, thank you a lot for coming today. Thank you for accepting to come and do this with us. And thank you to our audience for always being here. And if you happen to find this episode very insightful, if you find it helpful to you, please go ahead and click the like button and click the share button and follow us for more content like this. And until then, stay safe, and we're going to see you in another episode of Secure Africa.